So hip pain can be annoying with sitting, standing, walking, even sleeping can be uncomfortable when you're dealing with hip pain. Now today I'm going to talk about the 3 common causes of hip pain, what you might be dealing with based on your symptoms, and what you need to do to start solving it. So keep watching this video. If you're dealing with hip pain and you want to know a little bit more about what's going on with your body, I'm going to talk through that today. So as a physical therapist who specializes in pelvis and lower back issues, hip pain can really affect your life. Whether it's going for a walk and being able to walk your dog in the morning, or doing an exercise routine, or even that race that you want to do is coming up, you want to bike, you want to swim, you want to run or walk, and you can't quite do that when you're dealing with hip pain because it has to do with really weight bearing and putting the pressure on it. So I want to discuss with you the 3 most common things I see people with hip pain, what they're experiencing and why it's causing it. So keep watching and I'll explain it to you. Now, this doesn't come without a little anatomy lesson because I want you to understand your body even more. So I'm going to show you the spine here, and on your spine at the very bottom you have your sacrum, that's your tailbone, and your pelvis or your ilium are attached to that, creates what's called the SI joint or sacroiliac joint here in the back. And then from the front, you can see here's just the top part of your femur, your thigh bone, and it sits like a ball and socket right there at your hip joint. So that femur sits inside the hip socket. It's padded with cartilage. Many times people refer to it, or you've heard as a labrum, so it's a ball and socket there. And hip pain can be coming from more the side of your hip, the back, or even the front and the groin area. So we're gonna go over those 3 types of symptoms that people commonly get and what could be causing it. So it's important to know where your hip socket is here on the side. And then you have your sits bones, but down here when you're sitting on your bottom, you can feel those there. You have muscles, ligaments, tendons, all of that over here. And even what's called a bursa, which is a fluid-filled sac that protects your joints. And you have them in different parts of your body, different joints there, but you have a large one, your hip bursa on the side here. So that's what it looks like through your pelvis. So the first most common cause of hip pain that I tend to see, and it's a lot of times related to muscle imbalances. So if you're having something repetitive you're doing over and over, or a certain posture you're always getting into, your pelvis is going to be off where you're always using one side of your body more than the other. Very common in people that have some slight scoliosis or doing a lot of repetitive motion, things for their job, always on one side, or weight bearing through one side of their body all the time. Now, this can affect the side of your leg, even traveling down. You may feel this achiness on the side of your hip. Hurts the most when you're sitting and you go to get up. It feels really tense, tight, sometimes burning, aching are things that I hear from my clients. Now, this is a classic sign of hip bursitis when we're talking about right on the side of your hip. It may even hurt when you lie on your side, you go to sleep at night, and you're putting pressure on that area. Because I mentioned you have a bursa, it's a fluid-filled sac, it protects your joints, and your muscles lie over that. If your muscles are tight around your hip or not strong enough compared to the other side, so you're overusing it and it's getting fatigued and weak, it can compress on that bursa and cause pain. If you are saying it's IT band syndrome or it hurts on your IT band, you looked up some things on Google and you're trying to foam roll that IT band, maybe you're a runner or you like to do a lot of lunges or squats and it's hurting along the side of your leg, you have to go to the source. So it could be that muscle, your gluteus medius or your TFL higher up, and that lies right over the bursa. So we look at and assess those muscle imbalances from one side to the other and what your symptoms are like, what you're experiencing. But it could be trochanteric bursitis or hip bursitis if it hurts directly on the side, especially when you put pressure on it. Can feel burning, aching, and hurt after sitting for a long period of time. and maybe you are having pain with walking any length of time. So that is number one, a common thing, and actually pretty simple to treat with a physical therapist, because it is a lot of times related to muscle imbalances, and correcting those with the right stretching and strengthening program can make a huge difference in your outcome and results. So the next common thing is osteoarthritis, or having arthritis in your hip. Now, how do you know if you truly have that? Well, it would be diagnosed under an x-ray, but there are screening tests that we can do as a physical therapist to find out if it could be deep inside the joint where you're lacking that cartilage and the support of your joint deep inside. And with our arthritis, you start to get more of that bone on bone, lack of cartilage, more rubbing there, and people tend to complain of groin pain. So that pain that's right in the crease, maybe it is, like I mentioned before, some symptoms that coincide with bursitis, where you're sitting and you go to get up and it's stiff, it's hard to bear weight on it. It hurts first thing in the morning because your hip gets really stiff. It's been in one position for too long. So with arthritis, we say motion is lotion. It likes to move, it likes to stretch. And if it's advanced arthritis and you're really lacking that joint space and having more degeneration of the cartilage in that joint, then walking for long periods of time can start to get really uncomfortable. And that's when it might be advantageous, where we would discuss other options. If traditional physical therapy and getting the muscles stronger around that area, if that's not helping, we may look down the road toward possibility of a hip replacement in the future. Now, there's many things that people see us for that can eliminate surgery or even prolong that. So working on the right stretching and strengthening exercises so you put less compression in the joint. I find that people with arthritis, they really don't have a lot of flexibility. And if we start working on the muscles around it, their symptoms can improve immensely. We even use Pilates as a form of strengthening and stretching exercise that you can get the most out of without bearing weight and putting a lot of pressure on your joint. You can also get in the pool because it's going to not have the same sort of outcome with the irritation in that joint, and you can get exercise and movement while being weightless and not having that impact on the joint. So arthritis can commonly feel like pain in the groin area and stiffness first thing in the morning, and sometimes after a lot of activity or later on at night, you're saying that it hurts, it feels achy, it feels stiff, and sometimes sharp and painful. So the third most common type of hip pain that I see is sciatica. Now, sciatica can mean a lot of different things. It may be coming from your back, or it may be coming from your hip. That's for us to do an assessment and decide with different movement tests, asking you questions, and going through a screening to find out where the issue might be coming from, if it's coming from a true muscle in your buttock area or coming from a back problem. Now, your sciatic nerve runs through a muscle, and sometimes in people it runs through the muscle, and other times, more commonly, it runs underneath a muscle called the piriformis, and this is deep in your hip. So sciatica can truly feel like a pain in the butt or a pain in the back of the leg. Now, symptoms can get worse with sitting. That's what I hear most commonly, because you're putting pressure against that nerve and against the muscle there. So sitting in the car, sitting at a desk, sitting on your couch, that can be the most irritating for people. We tend to teach posture correction techniques, stretches, and exercises to alleviate that pressure against the nerve and the irritation the nerve is having, because it's not getting enough blood flow and circulation, and therefore it can feel like numbness, tingling, pins and needles, sharp pain. But usually people, if it's true sciatica, they say it feels like a pain in the butt, and many times can travel down the back of the thigh or even down the entire leg to the bottom of the foot. Now, sciatica, like I mentioned, does not always require seeing a doctor for an injection or surgery or having to take medications for forever and ever. You really can solve the root cause of sciatica by finding out where your muscles may need more stretching or may need more strengthening, and even positions that you can take pressure off of the nerve. And so it stops feeling like that pain in the butt and you can get that better. Some people with sciatica have trouble sleeping, they have trouble getting in a comfortable position, or they have trouble weight bearing and walking for long periods of time. So I would say with sciatica, you really need to find out where the root cause is so you can have the best program tailored toward your needs, because everyone with sciatica is going to present a little bit differently. So beware of just looking up exercises on YouTube or Google for sciatica. You really need to go to an expert and get assessed. So what to do if you can't see a physical therapist? Well, there's lots of virtual options to contact a specialist and get online and talk to someone. That way, there's a lot of things that we can do virtually to be able to coach you through and guide you in the right direction. If you don't have access to see somebody in person, there are virtual options too. I think it's important to note that doing some gentle stretching and strengthening is usually going to do more benefit than not. So movement, your joints and your muscles, they like movement. You want to make sure if you are working on some stretching exercises that you're not making the problem worse. If it hurts when you do it, that probably means it's going to irritate the problem. So stretches and exercises should feel therapeutic. They should feel like they're working the right thing, but they shouldn't be irritating the pain. You can also try heat or ice in the area and see if that calms your symptoms. And just look at what you're doing in your daily routine. Are you always sitting in the same position? Are you always repeating the same activities over and over? Something might be irritating it. And if you start eliminating those things or changing your posture, then that can make a huge difference as well. So I hope you found this helpful. There's many other types of hip pain, but I wanted to cover the top 3 that I tend to see the most and what we really get success with. So comment below, tell me what you learned. Are you dealing with a hip issue that is one of those top 3? Let me know. And if you haven't already subscribed to our YouTube channels, Level 4 Women's Health, hit that subscribe button so you can be updated on more advice on injury management, Pilates exercises, and more women's health topics. Thank you so much for watching.